As a branch off of the Ivey Business School at Western University, the Ivey International Center for Health Innovation is a third-party academic center that works to take proven health sector innovations and implement them into the system. Ivey Health attempts to merge the efforts of the public and private sector to cultivate positive change in Canada's health system and around the world. Ivey Health achieves this by taking a value-based health management approach. But what is value-based health management? Value-based health management is rooted in reducing healthcare costs while maximizing value for patients and funders of the system. For the duration of the academic year, I have had the pleasure of working at the Ivey International Center for Health Innovation, where I learned firsthand about value-based health management while writing blog posts for Ivey Health's Health Innovation blog. The Health Innovation blog is a platform for students, staff, and community members to address healthcare challenges or gaps and discuss future improvements. During my time at Ivey Health, I authored 4 blog posts on various topics. Through writing the blog posts, I completed a number of tasks in my role of student research analyst at Ivey Health. To gain a better understanding of this role, let me take you through my experience writing a blog post. The majority of my work was conducted at Ivey Health, which is an office setting at Western University. Twice a week, I would go into the center to research and write my blog posts. The blog post process begins with picking a topic rooted in value-based health management. To do this, I would read about current research being conducted to familiarize myself on relevant health issues. Sites utilized were Western Library's database, Andre Picard, and Healthy Debates. Once I chose a topic, I had to get it approved by one of the research associates, Lisa or Alex. Then I would immerse myself in the literature to address the gap and suggest an innovative solution. Often this looked like reading articles from various academic platforms, such as Medline, Scopus, and Embase. However, at times it also included meeting with stakeholders in the system to gain different perspectives on the topic. Connections with stakeholders were made through Ivey Health, and individuals were contacted via email. Interviews, however, took place in person and were recorded and transcribed upon the individual's consent in order to include direct quotes in the blog post. After the appropriate research was gathered and analyzed, I began writing the blog post. The actual writing of the blog post only took a few hours. However, each blog post went through a series of edits by the research associates and stakeholders prior to publication. Once the finalized version is approved, a member at the center will post the blog on the Ivey Health website for students, staff, and members of the community to view. The blog post process in its entirety takes approximately 1.5 months between research, interviews, and writing. This semester, I wrote 2 blog posts on various health topics rooted in value-based health management. The first blog post I wrote examined women who have experienced intimate partner violence in rural settings and their access to and experience with the healthcare system. At some point in their lives, 25% of women worldwide will experience intimate partner violence. This is equivalent to 1 in every 4 people. IPV against women is a grave public health concern, with both direct and indirect health implications to those who have experienced it. These health issues are amplified in rural settings and often perpetuated by the healthcare system even after the abusive relationship has ended. The dominant response in North America to support women who have experienced violence is women's shelters. However, women are shifting to utilize shelter resources but are not necessarily staying in the shelter, which suggests a modification from an inpatient to an outpatient model. For this blog post, I had the opportunity to interview Dr. Tara Mantler, who suggests that an innovative solution to tackle the shift in service delivery might center around a hub model, which would allow women to access services while remaining in community. However, to actually enact this is a bit challenging. Dr. Mantler states that although people want to facilitate interdisciplinary collaboration and integration, the way that the funding is structured makes this difficult. To overcome these financial barriers, Mantler, in consultation with the shelters, is hoping to embed a nurse practitioner into a clinic in a rural setting, someone who can provide care in a trauma and violence-informed way, and in turn, help women to better articulate what they are experiencing. In addition to my blog post that focused on women's experiences with intimate partner violence in rural settings, I am currently working on my second blog post this semester. In this blog post, I'm investigating the rise of chronic disease on a global scale, specifically comparing chronic disease in low-income countries to that of high-income countries, while noting the costs of chronic disease on the healthcare system. 38 million people die each year from chronic disease. However, these deaths are largely preventable by governments implementing frameworks to reduce chronic disease and promote healthy living. In my blog post, I am working to compare and contrast country responses to the rise of chronic disease using Canada as the baseline. At the beginning of the semester, I outlined the following learning objectives: to further my understanding of how value-based health management is beneficial to the healthcare system, to write my blog posts from a value-based health management lens, to improve my writing skills, and to conduct new research strategies and academic article search skills. It's evident based on the work I've conducted that I have achieved these learning objectives and have had an extremely rewarding experience at the Ivey International Center for Health Innovation.